A doctor diagnoses patients using rules from medical school. If fever and sore throat, suspect strep. If strep tests positive, prescribe penicillin. Humans encode expertise as rules. But can a computer use the same rules to diagnose? And more puzzlingly, why does encoding intuition as rules feel like it loses the intuition? Let's think about how experts think. A lawyer examines contract language. A mechanic listens to an engine noise. A radiologist reads an X-ray. They're not consciously calculating. They're applying rules learned through years of experience. If headache and neck stiffness, suspect meningitis. If contract lacks non-compete clause, flag risk. If engine knocking at startup, suspect low oil pressure. These rules are expertise made explicit. Computers can't absorb 10 years of training like humans can, but they can follow written rules. Here's what's weird. Rules seem reductive. Fever plus sore throat equals strep is oversimplified. Real diagnosis is subtle. Yet somehow, encoding rules into computers works. Why? Because rules aren't meant to capture all nuance. They capture patterns. The patterns humans learn through experience. You might think, just write out the logic formally. Every possible condition and consequence. If fever greater than 100 degrees and sore throat pain is greater than 3, then suspect strep equals true. But real medicine is messier. What if fever is only 99, but pain is severe? What if the patient is immunocompromised, which changes everything? Pure logic requires you to enumerate all combinations. Impossible. Also, rules can conflict. If patient is elderly, reduce medication dosage. But if condition is severe, increase dosage. What if patient is elderly and severe? Logic doesn't have built-in conflict resolution. And rules don't account for uncertainty. Medical diagnosis is probabilistic. Fever could be flu, strep, or other. What's the likelihood of each? So rule-based systems work in narrow domains with clear patterns, but break in complex real-world domains. This is actually deep. Formal logic has limitations and computational complexity. Real-world reasoning requires non-monotonic logic. Conclusions can change, fuzzy logic, or probabilistic reasoning. The more sophisticated systems combine rules with uncertainty. Rules are if-then statements. Let me show you how they combine to solve problems. A rule. If conditions, then conclusion.
Example, if fever and sore underscore throat, then suspect underscore strep. If suspect underscore strep and rapid underscore test underscore positive, then streptococcal underscore infection. If streptococcal underscore infection, then prescribe underscore penicillin. Each rule is a pattern. When conditions match, the conclusion follows.
Forward chaining is data-driven. Start with facts, apply rules, derive new facts, repeat. Example. Facts. Patient has fever equals true. Sore throat equals true. Rule fires. If fever and sore throat, then suspect strep. New fact. Suspect strep equals true. Next rule. If suspect strep and rapid test positive, then streptococcal infection. We have suspect strep, but not rapid test cluster yet. Doesn't fire. Perform test. Result. Rapid test positive equals true. Rule fires again. New fact. Streptococcal infection equals true. Next rule. If streptococcal infection, then prescribe penicillin. Conclusion. Prescribe penicillin. Forward chaining. Start with facts, chain rules forward, derive conclusions. Backward chaining is goal-driven. Start with a goal. Work backward to find supporting evidence.
Goal. Does patient have streptococcal underscore infection? What rule concludes this? If suspect underscore strep and rapid underscore test underscore positive, then streptococcal underscore infection. So we need suspect underscore strep and rapid underscore test underscore positive. What rule derives suspect underscore strep? If fever and sore underscore throat, then suspect underscore strep.
Do we have fever and sore throat? Ask patient. Yes to both. Do we have rapid test positive? Perform test. Yes. All conditions met. Conclude. Streptococcal infection equals true. Backward chaining. Start with goal, work backward, find evidence. Which is better? Forward chaining derives all possible conclusions. Then you can query any of them. Comprehensive. Backward chaining focuses on specific goal, doesn't explore irrelevant facts. Efficient. In practice, hybrid systems use both. Forward chaining for automatic detection. Backward chaining when a specific diagnosis is queried. What if multiple rules apply? Conflict resolution strategies. Specificity. More conditions equals more specific equals higher priority. Recency. Newer information beats older. Explicit priority. Write priority into system. Example, if fever and sore throat and swollen lymph nodes, then likely strep, is more specific than if fever and sore throat, then suspect strep. MYCIN was a landmark system in 1970s, diagnosed blood infections and recommended antibiotics. If organism is gram-positive and morphology is coccus and growth is anaerobic, then organism is likely Clostridium. System had about 500 rules. Experts spent years encoding them. MYCIN's accuracy rivaled expert doctors. It showed rule-based systems could work. But MYCIN was narrow, brittle, and hard to maintain. Adding rules could break others. Modern AI moved away from hand-coded rules toward learning from data. But rule-based systems are still used, especially when explainability matters. Brittleness. Rules work in narrow domain, fail outside. Combinatorial explosion. N conditions create 2 to the n possible combinations. Hard to specify all. Uncertainty. Rules are binary. Medicine is probabilistic. Maintenance. Modifying one rule can break others. Complex interactions. Escaping the problem. Probabilistic rules, learned rules, or hybrid systems combining rules and learning. Remember the question? Can computers use rules to diagnose like doctors? And why does it feel reductive? Yes, computers can use rules, and it works surprisingly well. Why does it feel reductive? Because rules are abstractions. They don't capture the subtle reasoning a master doctor uses. They're pattern matching, not deep understanding. But here's the insight. Humans also use pattern matching, mostly unconsciously. A radiologist looks at 10,000 x-rays. Her brain learns patterns. She's not consciously running logic. She's recognizing patterns. Rule-based systems make that pattern matching explicit. The system is brittle because it can't adapt when patterns shift, but it's explainable. You can see why it recommended something. When you have expertise to encode, elicit rules from experts. Represent them formally. Use chaining to derive conclusions. Resolve conflicts with priority. Rules are most useful when the domain is narrow, you need explainability, and rules are stable. For everything else, machine learning wins. Rules are how experts think made explicit. They're reductive but powerful. When you can write the rules, rule-based systems work.